from the Hospital and the Control Medical Subdivision. As you all know, followed by the appointed as Professor of Surgery and Head of Faculty at the, as I mentioned, Medical Superintendent of CWM Hospital.
And thank you for this opportunity to be here. The Australian Deputy High Commissioner to Fiji, Your Excellency, Senator Doni, Dr. Stephen Hoey, the officials of government, Commissioner Northern, and the heads of government in the Northern Division, the chair of the Savusavu Hospital Board of Visitors, and the subdivisional medical officer, his senior sister in charge, and also the subdivisional health sister, and all of us that are here today. This subdivision is the biggest that we have in Fiji geographically, maybe not in terms of the numbers, but geographically it's big. And today the handing over the biomedical equipment, which is this, is an opportunity to be able to continue to enhance the work that we do. We've talked about the usefulness of oxygen, and I don't want to elaborate on that. The only thing that I want to say is that we began to look at universal health coverage as a means to achieve health in this country, which means that we are sending the specialists, we're sending specialized services right down to the community. And I'm pleased to say that I've just talked with the subdivision medical officer and the team from Lambasa specialists have been coming here on a regular basis. And this is one of the things that we're going to do. So the opportunity to have oxygen concentrators here is not only for the patients that come on a regular basis, but also the opportunity to be able to look after those that the operating teams will come and look after. Now, I'll just keep on going right very quickly through because we've talked about this, but I just want to say that our oxygen budget is more than $3 million a year. And when I came into office, I made it very clear that we should be looking at renewable sources. And obviously we have oxygen in the atmosphere. And to hear that QKids together with the Australian government have been doing this was very exciting for me, because this is what we need to do all around Fiji. One of the things that we are trying to do also is ensure that we have a very resilient health system and very robust. So in terms of an emergency, if there's a natural disaster, then each and every facility should be able to stand alone and work on its own for at least 2 weeks. That's my belief. And the other thing is the ethos of the government, our government, which is the Fiji First government, is that we don't want to leave any Fijian behind. So in our humble opinion, no one should die because of a lack of oxygen. So just being able to have this project done and continuing to work on it. We've had ongoing discussions with DFAT and QKids about how we can roll this to other places, and obviously if you and Savusavu can keep Anna Doherty more happier this evening, maybe she will also think of that. But I just want to finish by saying I don't want to say much. There's a lot of things to say, but I don't want to say much. I think the most important thing is I'm just glad to be here. I'm glad to be able to receive the oxygen concentrators from a very good friend, which is Australia. As you know, we're working with Australia on a bilateral agreement called the Valley Agreement. We have a current agreement with New Zealand. And the fact that two of our friends, Australia and QKids from New Zealand, can come together to help us have oxygen just tells us that as a nation, we have big brothers and big sisters that look after us. So thank you very much for the opportunity. Thank you for the oxygen concentrators. And Steve, thank you for all that you've done for Fiji and the Pacific. Yeah, thank you.
And I bring you greetings from QKids Fiji, and also from QKids New Zealand and from the University of Auckland. And at the moment, and I am from New Zealand, but this project is being wonderfully supported by the Australian government, and we're very grateful for that. And in New Zealand at the moment, we are even more than usually conscious of how important it is to come together and to pull together, particularly in the wake of those events in Christchurch recently. And it's so important that we do, that we work together, that we come together, that we are unified. And it's wonderful to be working together with you all, Fijians, Australians, New Zealanders, working on this project. And I just want to acknowledge that. And it is a privilege to be working together and to be standing with you all. And we do have a common goal, and that goal is to improve the health of Fijians. And as Dr. Joe was saying, I'm a pediatrician, and Cure Kids has a focus on children, and of course we have a bias there in Cure Kids, but this is not just for children. What we are doing here is for all Fijians, and in this instance in Savusavu and in this subdivision, and we're delighted about that, because we do believe that no Fijian, no child, no adult should struggle or die because of a lack of oxygen. It's just such a basic thing, such a basic need. And that's what this project is about. It's about addressing that oxygen need and making sure that it can be met. And I'm really just so grateful and also inspired by the commitment of the ministry to achieving that goal. And the ministry has shown that in many ways. And from the leadership that this project has had within the ministry, from Dr. Eric Rafai, who I just want to acknowledge, who's working very hard on this, and from the commitment that has been made in technical ways too, to the support of this equipment. And the ministry has created a post, a biomedical technician post dedicated to this work, which is really what this kind of project needs. All projects, they need good mechanisms to make them work. This is not just about machines. The machines are important, but actually keeping it all working. There are good machines too, but that kind of capacity is so important, and the commitment of the ministry in supporting this is really is wonderful. So this is your place, and this is your project, and I just want to thank you for allowing Cure Kids to be part of it. I just want to acknowledge and just thank God for all of you here in Savusavu, for you in this subdivision and wider division, and in Fiji, for everybody here today. And just I'm grateful for the work that is being done together among us. So, vanaka vakalevu.
Bula everyone, and good morning. The Minister for Health and Medical Services, Dr. Waqainabete, Dr. Stephen Howie, and the Cure Kids Fiji team. The Commissioner Northern, Mr. Josefa Vithaya, the Northern Divisional Medical Officer, Dr. Goriniasi, the Savusavu Subdivisional Medical Officer, Dr. Samalua, staff of Savusavu Subdivisional Hospital, members of the media and friends. Bula everyone, and good morning. The Minister for Health and Medical Services, Dr. Waqainabete, Dr. Stephen Howie, and the Cure Kids Fiji team. The Commissioner Northern, Mr. Josefa Vithaya, the Northern Divisional Medical Officer, Dr. Goriniasi, the Savusavu Subdivisional Medical Officer, Dr. Samalua, staff of Savusavu Subdivisional Hospital, members of the media and friends. Now, it would be remiss of me not to begin with a hearty congratulations to the Fiji Sevens team as well, following in Dr. Howie's footsteps. It was astonishing. The game was amazing. So congratulations to the amazing team. But I'm very happy to be here today to join the Honourable Minister in handing over the vital oxygen concentrators to the Savusavu Subdivisional Hospital. So it's always so nice to get an opportunity to work outside the office. And Savusavu, this is my first time here, is the most beautiful place, even more beautiful than I could have imagined. I'm very honoured to be here with you this morning. So I consider myself very fortunate not only to be in an incredibly beautiful place, but also to be here, to be part of the handing over of life-saving machines to the Ministry of Health and Medical Services. So I'm told that approximately 200 children each year die from pneumonia. And I think we'd all agree that that is too many young lives for us to lose from such an avoidable illness, especially one which can be treated with an unrestricted access to oxygen. So Australia is very pleased, indeed we are delighted to be partnering with Cure Kids Fiji in this noble mission to ensure that hospital patients who need oxygen to assist in their recovery are able to access it freely. And as we all know as well, while access to oxygen therapy in a hospital is important, ensuring patients have unrestricted access to high quality oxygen is the goal. These concentrators, which we'll hand over today, are tried and tested the world over to provide hospital patients with a higher oxygen concentration level than the levels in the regular air that we breathe. So the benefits of having access to world standard oxygen therapy means that recovery time is shorter and the risk of infection decreases. So relatively inexpensive and low maintenance, we are confident that these machines will have a major impact on the continuum of care here at Savusavu Subdivisional Hospital. So I understand that Cure Kids have introduced and installed oxygen concentrators at 3 other sites, in Nusori, in Nambuvalu and in Tavuni. We are pleased to learn that the introduction of these machines is already starting to have a positive impact on the operating budgets at these facilities. So that is very encouraging because it means there are additional resources to dedicate to other parts of service delivery. But of course there is always more to be done. And I applaud the relationship that Cure Kids Fiji shares with the Ministry of Health and Medical Services. So this partnership began in 2014 to support the reduction of rheumatic heart disease, and it continues with the installation of these oxygen concentrators. So Australia, as I mentioned before, is very pleased to support this partnership and to fund a reliable, cost-effective solution to provide much-needed oxygen therapy that will ultimately save lives. So it gives me great pleasure to join Cure Kids Fiji's to hand over the 5 oxygen concentrators to the Honourable Minister and the hard-working team here at the Savusavu Subdivisional Hospital. I look forward to learning how they have added value to the important work at this facility. Vanaka.
3. And while they are there, we'll invite the Deputy High Commissioner and Dr. Steve to present the official certificate to the Honourable Minister.
Okay, now you can put it out of either of those, so you can have a combination of, if you want 5 and 5 out of 2 outlets, you can do that, but it can deliver 10 litres maximum.
Today's occasion is we are quite blessed here in Savusavu Hospital. We've been supplied with 5 units of oxygen concentrators by Cure Kids working hand in hand with the Australian government and also our facility team at the Ministry of Health. We're so fortunate that we are one of the facilities that this important kind of machine that has been introduced in Fiji. Before we have this, we have our own, we have ministry budgeted for oxygen cylinders, which we need to acquire or buy from suppliers in Lambasa. And every now and then we have challenges, the hospital have challenges in trying to acquire these oxygen supplies. Challenges like getting oxygen, especially if we run out of oxygen in the times that we not expected, middle of the night, on weekends. And the process we have, like acquiring this oxygen, we need, you need to sort out with the finance team and a lot of officers need to sign in order for us to release it. The suppliers need to release it. So those are the challenges, and the challenges also comes in terms of budget. Sometimes we don't have budget on our side, and we rely on further cash to be released in order to get cylinders. But when we have this, this is basically converting atmospheric oxygen into one that the patients can use. So one, it kills a lot of things at one time. Help in the finance side, we can use it anywhere. So we've installed 5 units here at the maternity labor room. We've installed it in our main general wards, and also where the children are admitted, and in our general outpatients. So very handy, and it'll help us along the way.